Even now, several years after the beginning of a pandemic, there are still new developments of technology that's helping consumers and the public deal with health issues. This is an example from the state of Oregon where the health authority there is offering free telehealth appointments to see if you can get medication for COVID. And this is a good thing because many times it's not actually necessary to go in person to check into eligibility for medication. And by having a telehealth appointment, first of all, you're going to save time so that the potential patient doesn't have to travel and wait in the waiting area and go through all that process, but also saves time for the provider because, look, if you're a medical provider and you're not using telehealth, you actually have to make appointment time in your facility. Somebody has to walk in the door, and your gap in between one patient and another, you have to leave more room because somebody might show up late. You might take longer with somebody. With telehealth or telemedicine, you can actually stack appointments closer together and also probably have less time for each appointment and make it more convenient for the patient. You also don't need as much physical footprint of facilities to handle those appointments. And here are the details. Now, again, this is in Oregon, and other states have similar things. It's the Oregon Health Authority. And through this program, any person in Oregon, regardless of health insurance status, can make a no-cost telehealth appointment with a clinician. Clinician will determine whether the individual is eligible to receive antiviral medication. It's the 5th state to join the program, and there's other states that are basically kind of join in very, very soon. And they've done 33,000 consultations in this program. Think about that. When you're doing consultations at that level, how much more resources and much more time would it have taken to do all that in person? And by having it done using telehealth or telemedicine, it can make the process easier and more available, more accessible to more people that may not have transportation, may not have the time. And even if you do have transportation and time, it's much more convenient, right? You can live your life better and maybe not, if you do have something that's transmissible, you're not going to expose other people to it because you can stay in your own home. So tell us what your thoughts are on this type of remote access to resources and remote access to expertise when you have a health inquiry.